All right, Tim, what do you got for us?
Well, we're going to go through kind of a basic understanding of where your movement issues are. I'm going to look for deficits in where your body's been overused and understretched versus the areas that are underused and undertoned. And what we're going to try and do is create alignment through that. And that's why, I like foundation training so much, because a lot of what we're going to see, and even with you, even with all the posterior chain stuff you do, we'll probably see some anterior chain dominance, and that's probably what's messing you up. So we'll look at that. We'll look at your spiral lines. We'll look at just kind of how your body's functioning right now, and then take you through some different steps that I use depending on the stage of the injury, what phase you're in, what your objective is, and then what I'm trying to accomplish as well. So I'm going to take you through, a bunch of things today, so that you can have a little sample of each one. Certain things are going to work better for you than others, but we won't know until we get you up in there and try it. So your feedback's really important. I don't like to work on anyone. I like to work with people. So that's really going to be the premise of what we're going to do today.
Psyched, man.
Right on.
Awesome.
Cool. So we can just start sitting down here. Okay, and sit way up high.
Up top here?
Yeah, and put your feet in the holes.
I need a manual though.
Yeah.
It's sitting right.
That's it, right there. You're in it now. And this would be technically ideal. This is called Bruger's position.
Bruger's position.
Yeah, when your hands are out, because we tend to want to go like this. Even, people doing, the fake yoga stuff or the fake meditation stuff, you see their circles in here and they've got to be out, because we're trying to open, right? Everything's opening. That's kind of the premise here. We're opening here. We're aligning the spine. So this is just a great alternative way to sit, Is it going right now?
You rolling?
Yeah. Okay. Just checking. Just checking.
Oh, yeah.
Right on. So this is just, the basic fundamentals of, the beginning of our lesson starts right now.
Yeah.
One of the things that we do, whether we're an athlete or not, is we sit a ton, right? The average person sits 9.7 hours a day and sleeps only 7.2 hours a day on average. So we sit longer than we sleep. Something's wrong with this. And so anything that we can do to change it up when we sit, because when we sit in chairs, obviously we lose that spinal strength that holds us straight. Again, posterior chain stuff that you guys talk about and do such a good job with.
Yeah.
So this is a great example of, seeing how long you can sit yourself in a nice position. Normally, someone that's fit, that's just learning to sit in this position, lasts about 10 minutes before you just buckle.
Okay.
And so the good news is within 2 weeks you can sit for an hour or so on this thing. So it's a great way to introduce your body to a different way to sit. I also recommend moving every 20 minutes when you sit. Get up, do something active, whether it's a few push-ups or some burpees or some squats or walk up and down stairs. Those are very, very important products or processes that we need to go through. So with what we're going to do today, it's just kind of really about your history. So we've talked a little bit about it, and you have some anterior chain stuff that's holding you back. You've got some hip flexor issues that seem to be kind of chronic for you. You've got some new neck stuff going on. So what I'm going to do is take you through some movements. Some are classic movements, some are classic orthopedic tests, neurological tests, etc. Some are not classic, and most of them probably won't be. But that, my background has led me to this point in my career. My background is also really interdisciplinary. So I really believe in working together with different professionals to get the best outcome for the patient. And interdisciplinary is different than multidisciplinary. Multidisciplinary is what's kind of out there today, where you've got a lot of disciplines working on the same case, but they never talk to each other. And in fact, they don't like to talk to each other. And so that really, puts a big block in the roadway of someone trying to move down the pathway of health.
Yeah.
So, we like to work with people that are collaborative, If not, you're compromising. And compromising means one or both of those parties isn't getting exactly what they want, and we want to give you exactly what you want. The downside to that is that you have to participate in your own care. I can't do this stuff for you. We can figure stuff out. I can present you with a roadmap, but I can't walk the map for you. You're going to have to walk it on your own and with others. I'm always here to help you, to give you direction. to make sure that the light is shining on the proper path. But it's really up to the patient to participate in their own care. And if I get a good outcome, it's because they've done the work. It's not from me, it's the patient. So that's, I think, why athletes come to see me, is because they're willing to do the work, but they just need the recipe, or like I say, that roadmap for their journey.
Yeah.
So one of the first things that we're going to do today is just really talk about breath.
Okay.
Okay, so my thing, or my structures of my care, is based upon first alignment. So learning what alignment is. Sitting in this position certainly teaches your body great alignment from a sitting perspective. And then I think the next important thing to learn and progress through is learning breath. Can you take a solid diaphragmatic breath? Do you even know what that means? And when I look at most people breathe, they breathe with their shoulders. When their shoulders raise when they breathe, it's a tough sign. They're going to start from, really point A. What they're doing when they breathe and lift the shoulders is not only are they not getting in adequate oxygen, but they are stimulating the sympathetic nervous system to go into fight or flight. So if you can imagine sitting at a desk all day, breathing like this because you're under stress from your boss or your deadline, you're already starting off way behind the deal. We haven't even got to number 3 in the things that make you fit. So you've got alignment, so posture is critical, and then you've got breath, learning how to really use your breath to send your breath anywhere in your body. Yeah. We learned in school that we had 1 diaphragm, and now we know we have 4 diaphragms. You've got 1 in the thoracic area, then 1 at the base of the cervical spine, 1 at the base of the brain, and then 1 in the pelvic floor. And the goal, which is what you guys teach so well in Foundation, is to pack those diaphragms, meaning you want them to work on every breath. We take 23,000 plus breaths a day. We should be pretty good at it, right? But most people fail at taking a good breath or understanding what a good breath is. So I've got some tools that help us cue people that have issues with their understanding diaphragmatic breath. So we'll be using those today as well. And then we'll get into mobility, which is kind of what we'll check now on you. We'll check some basic mobility things. And then we'll check stability. And stability is coordination. Stability is control. And stability means that your brain, your nervous system, and your muscles are firing and working together in synchrony to make you move smoothly and hopefully without peril.
Yeah.
Okay.
Oh, man.
So the first thing we're going to do is we're going to come off this thing and we'll get right into a little mobility drill. And it's a super simple check. Since you talk about, hips being an issue for you, or certainly the front of your hips, this kind of is a good giveaway. So we put this front leg at about 90 degrees, great. You don't want it in, you want it out at 90, so it's a little different than some people utilize in yoga stretch. And then back leg, you're in perfect position there for sure. So how do you feel right now in this position?
Right now I feel comfortable.
I
feel like I can sit upright.
Yeah, you feel like your spine's pretty straight.
For this side, very much so.
Yeah, that's great. It's really good, because that's really what we're looking for is you'll get a little cant to the side, or you'll see legs lifting when someone isn't comfortable in this position. So, I work with a lot of professional athletes, and 9 out of 10 of them can't get into the position that you're in without pain or without peril, so to speak. Okay, so let's go from this position, lean back on this hand, and then kick this leg out, swing the other leg around, and simply just switch positions. Great.
Now I feel the pull.
Yeah, you feel the lean a little bit.
Tension.
And a
little bit of like cockeyedness at the low back.
Yeah, so things are starting to happen now in this position here. So it allows me to understand what part of your body, what side of your body is dominant or tight. And that will be the side of the body that we focus in on when I do soft tissue work. Okay. The soft tissue work is so critical because it allows us to get this new range of motion, free up the joint, improve mobility so that we can see if that resolves the pain.
Right.
And if I work on a low back, Jesse, most of the time I don't have to literally work on the low back. If I end up working on the low back, that means these other issues or these other possible solutions have failed. They're not the answer. So usually we work with soft tissue in the hips. We can clear up the hips because the hips are supposed to be mobile and the low back is supposed to be stable, when we gain new mobility in the hips, we instantly take stress out of the low back,
Right.
which is the ultimate goal. There is no cure for low back pain, no cure for low back problems. Otherwise, everybody would be doing the same thing, and we'd all be heroes at it. But everyone is different.
Yeah.
So we have to take the time with each person, look at their movement profile, look at their breath, look at their alignment, and kind of move forward from there. Okay? So, so where do you feel that tension on the side?
It feels as though things have chilled a little bit. I could say it's almost like I've got to purposefully rock back just to feel totally upright.
Yeah.
And so I'll feel that little bit in the adductor. That adductor, a little bit of tension.
Okay.
I guess right in this.
Right. And this is super uncommon for this position, or not super common for this position to feel that. Yeah, sorry. So what we'll do now is we'll take you into some different movements as well that'll also find other imbalances. So from here, what we're going to do is we're going to go up into a tripod position, and just like in foundation, we want to find that position where we can get our legs to almost straighten out comfortably. And then what we're going to do, Jess, is we're going to slide our foot through our hand and roll over right onto the back. And then the goal is to make your body into a tabletop. Now, what you're going to feel in this position is glute max firing, hamstring firing, upper back firing, all these muscles through here, traps, middle traps, lower traps, rhomboids. But what we will find out here is how long can we serve that pizza on there for without you breaking down. Now, Jesse, it's not uncommon for me to get people into this position that can only go here. And this is the person with really tight anterior chain issues.
Yeah.
So upper quad, sartorius, iliacus, and psoas. Okay, come on down, sit. I want to talk to you a little bit about psoas. Psoas is something that we all talk about, all the body workers talk about, all the trainers talk about it, etc. But I read a book called The Psoas. It's a thick book about one muscle, so you know it's great for nighttime reading. But reading little chunks at a time, I learned that the psoas is not a primary hip flexor. After all these years, right, of working on it, it's not that we can't help people by working on psoas and creating length there, but what we found out was that psoas is really there to compress the anterior portion or right over the top of the labrum of the hip to help add stability there. That's its primary purpose. Its secondary purpose is hip flexion. So like I said, I still work on it. It's still an important muscle to work on, but now I know that there are 3 other primary hip flexors, iliacus, psoas, and sartorius, that need the yeoman's amount of work, that need more work easily than psoas. Psoas will come along for that ride too. The other thing that I see in psoas or anterior chain patients is that if we don't work on the upper body, the body has these spiral chains, right, these fascial chains. So if I am working on your right hip flexor or psoas, and then I miss this line here, when you bring your arms up, all this tension in here limits your range of motion. So I have shoulder patients with hip flexor problems. I have hip flexor problems that have, shoulder injuries.
Yeah.
So they work back and forth, and it's not something I was taught in school to kind of match up these upper and lower chains. We usually look at them individually.
Right.
And I'm learning more and more it's holistic. You can't be reductionist when you treat someone. Everything is connected, and that's our job, is to reconnect not only the muscles and the movement system, but also the nervous system, the brain, etc. All these subsystems, the breath, all those things along with movement make someone not only more supple, but also more injury proof.
Yeah.
Okay. So really good so far. Let's go ahead and check out now this position here. And all I'm going to do is have you put your toes in the ground. You're going to put your hands on your ankles, and then you're going to open up the chest. Now, one of the things we don't want to do when we open up the chest ever is flare the ribs. So you're going to feel like, I'm going to show you a flared rib. Okay, that's flared ribs. That's how I grew up. I grew up surfing on my ribs. So when I got out of the water, I just remained like this. I also had a terrible chronic low back. I fractured it, but also it wouldn't go away until I learned to stop flaring my ribs when I stretch and change my posture. And by changing my posture and then truly working on my mobility, things changed. And the thing that I got every other month, now it's maybe once a year. So I can control that. It's hard to control every month. It takes over your life, right? So that's a great stretch. Come on back again and open up. You get a nice chest opening at the same time, and I just want to watch you here. And where do you feel any pull?
No real pull.
Great.
Yeah, no, nothing really
Okay,
noted.
cool. And then come on back up, and now we're going to put the feet flat, put the hands behind the butt cheek, and this is a stretch that we're going to start from the knees. Same idea. Just push forward through here. Yeah, good. And where do you feel that stretch? All
Right
quads.
there.
One side more than the other, or pretty close?
Pretty close.
Okay, good. Not bad. Okay, great. Thank you. Great.
Ooh.
Yeah, huh? Right?
Yeah, that's good.
Okay, and so now we're going to go ahead and just kind of check your mobility in your hips on the side. So we're going to bring the head here. So bring this front foot out 90 degrees. There you go. Perfect. Thank you.
Right there is tight.
And where do you feel that?
Out external.
Uh-huh.
Right
Okay,
on.
great, great, great. And then as you bring your head more towards center, does that intensify?
As I come down more,
Yeah,
it does,
yeah, okay, okay, got it. And let's just swing that around, compare it to the other side.
Right about there.
One side feel tighter than the other?
I'd say hard to say.
Okay, we'll examine that later on the
feel
table.
Like the other side was more the glute. This side, I feel like it wants to kind of go up a little bit up into the low back.
Uh-huh, okay. So that usually would make that side tighter. Something that's radiating out of there is usually going to be your tighter side.
Yeah.
Okay, cool.
It just feels like that tension starts to go. It's hard to go along with it. Almost.
Got it. Okay, okay, cool, cool. And then let's go ahead and stand up. And just stand on one leg for me. Good. Now you're going to do a quarter squat on that one leg.
No matter what I do with this one?
You could put anywhere you like it. Okay, no pistol squat in this house. Come on back up. Now we're just going to do a quarter squat. So just there. And then back up. And then face this way. And same squat. Great. Good, good, good. Okay, so I want to see if you can keep your upper back a little more vertical.
Okay.
And do the same thing. That's far. That's way far enough. Yeah, good. Come back through. Opposite leg. Great work. Very good. Okay. And then face me and show me squat. Just regular squat. Great. And then turn to the side. Great, okay. And then one more time, I want you to go down as far as you can. Kind of Portuguese fisherman stance. Great. How do you feel down there?
I feel good. My upper quads feel tight.
Yeah, I'm seeing it in your right foot. If you look at your right toes, huh? See the tension there? Good.
Yeah. It feels okay, but I don't feel like I'd want to stay here all day.
Yeah. Where's it building up? Where's the tension building up?
Right, I think at the crease of my quad, like right in the hip joint in the anterior.
Okay, come on out of that.
Spot I felt when we stretched.
Yeah, bilaterally or one
Yeah.
side? Okay,
Yeah.
cool. Okay. All righty, good. We got good, good range of motion relative to most people that have these problems. So that's great. It leaves you with less to gain. You don't have to gain so much mobility in there to get a nice change in there. So I think that's what's going on based on my first read. Let's go ahead now and try this squat here.
Double check. I want to make sure that mic is on. Just I'm in my mind. I'm like, yeah, let's make sure the mic is good.
It's working.
It's working. You're good. You can see it reading. Okay.
Okay, so
and everything's working just fine. If it fucks up, I'll tell you.
Okay. So much gold.
okay, so this is called pulling down the house. Okay, everybody's got a door, I would imagine, so that's all you need for this exercise. This has changed the squat patterns of so many people. It's almost ridiculous, and it's kind of fun to do. It's a great challenge. It's a 2-week challenge. You do 7 sets of 7 squats. Each set or each rep should take 7 seconds. So just remember the number 7, and you're getting her done, okay?
All right.
Now the key here is you literally are going to try and pull down the house. And why are we doing that? Because most people don't activate enough posterior chain on their squat. They get to here and you see them start to cave over, right? That's because they're so dominant in the front that that's the only way that they can go without falling over. But if we take these 2 handles and we get a great squat stance, and then we start that squat by trying to push the hips back, just like in the founder, as far back as you can get them from the body, or in this case, as far as you can get them away from the door. Now we change everyone's squat pattern. The patterns that I see are here. When people squat, I can't even squat that way anymore. It's so bad for my body. But I look at the knees, and if the knees are coming forward at the start from the jump, we know that squat pattern's got issues. That patient's going to have long-term issues. If they came for a low back and we help them with their low back, this movement alone will send them back into peril.
Yeah.
Okay? So let's go ahead and try this squat. Okay, I'll just demo it for you here. I'm just going to pull all the way back, and you're trying for the ultimate perfect squat. The back is straight up and vertical. And then what I'm going to do now is I'm going to push through my heel, my calves, my hamstrings, and my butt to get to the top. I want to be really conscious of that. I don't want to feel anything in my knee.
Right.
Great. And you can really feel the connection, even with your pattern being as good as it is. We can always get better. When you do a quarter squat, you tend to come forward first instead of this one. So those 2 moves are real differentiators. Nice. Does it feel equal on the feet as well? Great.
It does.
Now what's going to happen is tomorrow you'll go into squat and there's just not as much pressure on the door. And then the next week, you're maybe doing it with 1 finger. And then maybe just the fingers are on top of the handles, just for proprioception, to know where you're at in space. And then within 2 weeks, you're doing a whole new squat. And adding this squat to someone's lifestyle and training system is almost about as valuable as anything that I can ever give anybody or teach anybody.
What do you attribute that adaptation to? That gradual less and less, and the body just starts to own it more and more?
It's deep proprioception.
Okay.
Because with that door and that security that I get from the door, I'm able to get into spots that I've never even touched before or knew were available. We mimic what we see as kids. That's why DNS is such a big part of this program too. Yeah. Because if Dad runs with a certain gait, I can almost guarantee you his kid's going to have that same gait. And the story that I relate to is like the first year I was in practice, this kid came in, 7 years old, wanted to be a runner. His mom says he runs with a limp. And so I examined his ankle, I examined his knee and hip. Everything's good in there. And so I gave him, he was a little out of balance, gave him some stretches to do and so forth, and said, I want to see you in a week after working on these stretches. I want to see if there's some improvement. So we had him run in the parking lot, and then the next week he came with his dad. Now his dad was a Vietnam vet and had shrapnel in his leg. And so they wanted to, the kid wanted his dad to run with him so I could watch him run. And his dad ran with that same gait that the kid was running with because of his shrapnel. The kid had only seen his dad run.
Wow.
And it's the same thing, especially in walking, right? Especially we see these as young kids, people walking. You can't believe watching a mother and a daughter walk together. Watch their arms, watch their legs. They're walking the same way. So yes, you can blame it on your parents, but the problem will still remain.
Right.
We've got to correct it.
You got to do the work.
Yeah, sure. So I think this is a really important drill that anybody can do and anybody can teach themselves. It doesn't take equipment or anything else like that. You're only using your body weight. And mastering your body weight for me is crucial to be able to move forward to a strength component. I believe you have to have your alignment, your breath, your mobility, your stability down before you should consider adding load. And it's tough because working with guys in the NFL, I mean, that's sacrilege, right? I mean, they need their size. I played football, not at that level, but college level, and I understand the need for bulk. I understand the need for size. I weighed 60 pounds more than I weigh today. But if I had to do it over again, I'd weigh 30 pounds more and be a lot more mobile.
Right.
And I probably would have had many, many less injuries, et cetera, through my career. So let's go ahead and now go up on the table, and we're going to just look at your lower body. I think kind of that's our main focus today will be your lower body. Maybe at the end we can throw in some stuff for the upper body as well. But I think people will get a bunch out of this. All right.
Sweet.
Cool. So we're going to test dorsiflexion.
Okay.
So,
All right, so go ahead and just,
Okay, we ready? Okay. One of the things we also have to do on everyone is check dorsiflexion, okay? I've learned that there's only really 3 areas in the body that you have to keep mobile for the rest of the joints to be healthy. So those of you that don't want to see, me, make sure that you focus in on this. And one of the things is dorsiflexion. So how well does that ankle move when you flex forward? Certainly in surfing it's huge, and in all sports it's huge. Being able to drive power for sprinters is critical. So let's go ahead and try this. What you're going to do is you're going to put your foot, start at about 3 inches away from the wall, and you're just going to see how far away from the wall you can get.
Okay. So starting right here. Boom.
Yeah. All right.
Nope.
Okay. So you're right there is about normal. Is it about 4 inches? You want to be able to get about a 45 degree on that angle there. So it's adequate.
Okay.
Can be improved upon, but it's adequate. So let's switch feet.
See if I can pick up right there. Adequate.
Good. Great. Nice. Okay.
I felt a little off, like I barely
Lifted
took
a
the
little
weight
bit.
off
Yeah,
the
yeah,
heel.
yeah.
So I'm gonna go forward just an inch. The heel's still
Okay.
kind of light. I think I started right at my end range.
There you go. So that lefty's a little bit looser than the right on that side. Okay.
Now, so what I want to pick your brain though is you said there's 3. This is 1. What are Tim's big 3 that the range is?
Oh,
at?
yeah. So you've got to have that ankle range of motion for sure in dorsiflexion, okay? And then you've got to have pure hip mobility. You've got to be able to go in all directions. And what I see lacking, and what's going to lack in you, is hip extension, right?
Yeah.
Because you've got tension in the front, it's going to limit your ability to go back. So how do we recognize that patient? Well, that's the patient with this stride, this little mini stride, right? It's just...
Is that how it came in?
No. But you'll note that they've got a pretty good front stride, but there's nothing behind them, and so it's a quick little gait. They're also the ones with very skinny calves. You can see a very big person on top with little tiny calves. Oftentimes it's because they don't have hip extension, no ability to push off on the calf, no ability to grow that muscle.
Wow.
So that's kind of an interesting observation that we've
I know
made
2
too.
guys are going to really want to know about that. Wade, Asher.
Okay, so we go from hips right into the thoracic spine. And the thoracic spine also includes the rib cage. The rib cage is a really kind of one of those unsung heroes in the rehabilitation area, because if you work on rib mobility along with thoracic mobility, you can get tremendous results throughout the whole body. So Jesse, what I do when I look at somebody is I'm really looking for their major area of where they move the least. And I work on that area. And oftentimes, regardless, if they come to me for a knee and their thoracic spine is tight, I stay with that. Of course, I want to get to that knee, but I really believe if a practitioner is working on the area that you have a problem with, if you have tendonitis in the elbow and they work on the elbow only, or you've got a low back problem, they work on the low back or mid back, they work on that area, they're not understanding the function of that area. Why did that area go out? It's being pulled by muscles. And those muscles, when they shorten, have tension, and tension will pull that joint out of alignment. And you have to identify where that tension is and then build a plan around that and try it in the clinic. Like today, I'm going to work on your anterior chain a bit and some of your lateral chain and see if we can't get a nice improvement in your ability to move better. One of the things that we'll check, and we'll check it right now too, is just simple range of motion. So let's watch you bend down. You're going to touch your toes.
All right.
Great, and that's great range of motion. No issues in the spine. Great, you've got plenty of room there. And then stand for me, and then simply hands on the hips. And now we're going to arch backwards, and we're going to look for little deviations. Oftentimes you'll see the body rotate. That looks really good. Is there any compression at the end of that range?
No, not that I can note.
Okay.
I was curious going in if I was doing my low back or not.
Yeah. Okay, so now what we're going to do is we'll get a little more specific with this.
Okay.
And we're going to look at the facets. And I like to test in closed chain whenever I can, as opposed to always on the table. It gives me a better realistic look at how gravity is affecting your movement too. So the first thing we'll do is we'll rotate right and then arch back. Great. And then come on up. And does that feel easier or harder than going straight back?
It felt like there was less tension I was working against on the front side.
Okay, so easier. Okay, so let's rotate this way. Good. And then arch back. How's that feel?
Feels okay.
Okay,
Felt like a
cool.
little tension in the upper thoracic when I got back there and came over.
Okay. So, really good range of motion relative to most people I see. You're going to get one side that's a little chippy when they go back in there. And that chippiness is a facet, lumbar facet, one facet driving into the other.
Okay.
When it's tight like that, the hip flexors are tight, it compresses those facets and leaves you no room to do that. And it hurts to go back into those positions. So that's good range right there. So what I'm going to do now is I'm going to put you on the table. We're going to let you go through this little moment of relaxation. And in fact, I think what I'll do is examine you a little bit more, then put you on the chi machine and let your hips just kind of have a nice little moment.
So the question I had for you though is, and I want to really hit for people out there when it comes to psoas, can that be the culprit and it's coming out in the back?
Oh,
that's the big one I want to be. I know it's probably already very clear for most, but someone out there's, or at least I know I would have been the guy.
Yeah.
Well, wait,
yeah, it's a big piece of it, but it isn't the only piece.
Right.
It used to be the only piece for me, right? Because that's where my knowledge was. But now I understand that not only is psoas involved in hip flexion, but in a secondary way, but it's that iliacus, upper quad, and sartorius that we have to pay attention to. So once I started to get into that, not only does it make the patients improve quicker, but it gives me more motions for them to work on outside of the clinic.
Gotcha.
And that's really where the work is done. Again, I'm going to try and free you up in here and give you the opportunity to go out there and move better.
Yeah.
It's not here. I'm not a healer. The body is the healer. I'm just the facilitator. I'm trying to provide the best environment possible.
Love it. Love it.
Okay, so let's just do a couple of moves here. Okay. Very good. All right, so I just want to get a feel for how the pelvis is moving here, and you can feel it drops nicely here. It's got a little attitude when we come back here. So I never base my everything on one test. I've got to do 5 or 6 tests till I'm satisfied that this is really happening here. It's a real deal. So what I'm going to do is I'm going to check hip flexor strength right now. So you're going to lift this leg up 6 inches, turn the foot out. I'll give you pressure and you resist, and then I watch how the body responds. Okay, resist, And you can kind of see and feel how that left shoulder is trying to get involved in this thing right now, okay? So that's that spiral I was talking about. So if you've got a hip flexor issue here and I don't follow that chain up there, you know, I'm gonna miss maybe 20% of what I could do to help you. And we'll find that line, it'll be red for sure. So let's test the other side and see how that feels. So lift that one up 6 inches, turn your foot out, and then resist. And it's like you got a cigar and a cup of coffee and you're not having any problem there. And did you feel the difference in how localized that strength was versus this one's trying to recruit your whole body?
Very much so.
Okay, so for me, this is the moment where injury happens. This is that pause. I'm going to do it again. You're going to know it's coming, but you're not going to be able to hold me up for about a second or two, and then you're going to recruit all these other muscles to try and do that. And we know in a football game or a volleyball match or something, you don't have that precious moment to recover. That is the moment where injury happens. So I hypothesize that these things can be part of that timing issue, that inability for your dynamic restraint system to go, boom, I got you.
Right.
Instead, it's like out getting popcorn at the concession stand, and it's like, oh, I was supposed to be there. And you're blown out, right? Okay.
Yeah.
All right. So let's see here. So now let's go ahead and test a couple other pieces of the hip. Okay. So let's go ahead and just slide your foot right up here, and just let me know how that feels. Let me know if you've got any areas of tension when we do that.
Right away.
Right into the groin. Okay.
Yeah. And
So
that's what's felt like been snagging lately.
okay. Right. So it's so cool, these tests. They really help us to identify exactly what we need to do. And most of them are patient participation tests, so the patient knows too. Okay, and that's really important. Okay, now we're going to stack that foot on top of the knee.
This one.
Good. And where does this one go to?
I got nothing on this one.
Okay, so I'm going to just give it a little bit of tension.
Right away, that. Right.
Same zone. A little more on top this time versus medial, or about the same?
About the same.
Okay.
Up into there.
Cool. Okay. And so because of this sign right now, I want to make sure there's no impingement. So I'm going to push you up here medially.
Yep, I feel a pinch.
Yeah. So that's something that, you know, hopefully we can clear up with the muscle work. If not, then that would be an indicator over time that we need to get some film of that. And film of the other side as well to see if there's bony changes happening in there, okay? I'm not a big fan of X-ray, but it's a great tool at certain times to see how long has this process been going on in there.
Right.
Okay, all right, so that's great. And then same thing here. Let's just try that little test on this wheel. Any snag there? All clear. And then I'm going to give a little extra gas on there.
Little bit of tension up in the
in the crease there. Okay, stack that knee on top of the knee, or foot on top of the knee. Great. And then tell me about this guy.
Same spot.
Yeah,
Definitely.
maybe a little juicier on this side here. Yeah, okay. So that's just a little more tension on that left side. So he's kind of creating a picture for me here. We're starting to see the story. All right, and now we'll come up here, and we're going to come right into.
Same tension.
Okay. So if we look at anatomy and we look at a bunch of femurs and acetabulums where that femur is supposed to fit in there and glide and stuff, you'd be amazed at how many funky looking heads on there and weird shape acetabulums, and how the bone hangs out sometimes, and sometimes it's really deep inside the joint. All those things, you know, create function or lack of there too. So if I have a patient and they're doing as much work as I think that they're doing and they're not getting the result, then we need to look inside and see exactly what's happening there. You might have got something from mom and dad that's not allowing you to do what you want to do.
Right.
Okay, so those are other variables. Okay, so I'm just going to go ahead now and get you into the chi machine a little bit and let you just cruise. And what this is going to do is sedate the nervous system. I'm going to put you into this parasympathetic modality, and it's done by the rhythm and synchrony of this machine, invented by a doctor from China many years ago. I've had this machine for like 20 years. And it's just one of those things that just keeps making a comeback. I use this machine primarily for those that have been traveling a lot, training really hard, or professional golfers that walk a lot in a week. You know, they walk well over 20 miles, you know, in the rounds that they play each week. So, and the other interesting thing about pro golfers is that they wear shoes to golf in, not to walk in. Yet they have to walk all those miles in these shoes that are really a lot of times not the most comfortable shoes you could get. So that's another factor. We see a lot of great toes on the left side. If you're a right-handed golfer, those great left toes have big arthritic problems as times go, and I think a lot of it has to do with the funky gait they do when they golf, and as well as them having to turn around that left foot when they golf. Okay, so let's get to legs up. Let me put this right underneath them. Wonderful. Slip the old chi machine up in the house.
Yeah.
Beautiful.
I haven't done one of these in a long time.
Oh yeah. There's a lot of them out there. Sun and Cone is the original company. They've got a lot of chi machines out there, like I said, a lot cheaper than the original one, but I know I've had this 20 years, so they must be doing something right. So here we go. Now, for you, you just chill.
Okay.
And what you're going to feel is this movement that's starting at your feet is going to work its way all the way up the body. And then pretty soon your head's going to be going back and forth. What I'm going to look for is what's happening with the feet. Are they moving the same? What do you feel, Jess?
I feel my feet brushing each other.
Do you feel like they're moving equally?
It feels more like the right is doing a lot.
Yeah, and I'm seeing the left.
Interesting.
So go ahead and look at your feet. See how that left's coming way over? So that speaks to me more restriction on the right side.
Okay.
Okay, left side, because you feel that, we got to pay attention to it. Also, we had some left positive tests when we tested the lateral part of that hip and then also the front.
Crazy.
Yeah, so just relax back. This is where we can work on the breathing. What we'll do now is we're going to add a little breath tool into the factor here. Let's slip this on underneath you, Jess.
Yeah.
Great. Wonderful. Okay.
Oh, I like it.
This is called the Core 360 belt. And what this is for proprioceptive awareness of breath. Now, what we first use this when you're static like this, just so that you can feel these four corners. What they are is four little hard plastic balls that when you breathe into them create pressure against your tissue so you can tell if you've got the breath going to that area. So what we want to do is we want to get it into that belly, we want to get it in transverse abdominis, and we want the patient to feel it on each breath. This helps people bring awareness to, you know, am I a chest breather and a shoulder breather, or am I a belly breather? Want to breathe through the nose too. Remember, breathing through the nose calms the central nervous system, puts you right into parasympathetic by stimulating the vagus nerve that's in the back of the throat. And how we stimulate that is breathing through the nose. And then if you choose to breathe back out through the nose, that's ideal. But if you choose to breathe out through the mouth, make sure the tip of your tongue is on the roof of your mouth. And you're breathing out. Making that sound. Take twice as long to exhale as it takes to inhale, and your body will actually perform at a much, much higher level. You're getting much more oxygen into the tissue. Also, when you breathe through the nose, you have nitrogen oxide in your sinuses stored there. The gas is stored there. Only when you breathe through the nose does it mix with the air and sterilize the air and add a component that causes vasodilation of the lower lobes of the lung. So you get a much better breath nose breathing. I recommend reading the book Breath by James Nestor. It's a game changer. How you feeling, brother?
Super chill.
Good. Great. All right, we'll just give you the mini version there. How's that buzz right now?
Awesome. I feel it coming through.
Yeah, you get a full endorphin rush when this machine stops, so it's like everybody loves it while it's happening, but loves it even more when it's over.
That explains why my brother, sister, and my parents had it when we were growing up.
Oh, is that right?
Addicted to that.
Yeah, it's just a great feeling.
Yeah.
All righty, well, let me pull this off. Thank you. All right. Let's take the breath belt off. Now, when I learned to use a breath belt, not only did I learn to use it statically, but I also learned to use it with my exercises. And it is a huge challenge to breathe properly, even when you're doing the most basic movements. So for foundation practitioners, I could think of no better tool really to add to the kit.
Yeah.
Because it really helps you to teach your clients how to get that elongation, where to put that breath, how to feel the breath not only in your belly but in your back. And then from there we want to teach your clients or your patients how to move your breath through your body, how to send breath into your ankle. And it's not literal, but it's a sense of doing that. And when you're doing that, you're calming the nervous system, you're sending in tension down, you're getting oxygenation into the tissues. So there's a lot of great stuff that just simply comes from breath. Okay, so let's get into a little tissue work, all right? Let's see how that feels.
Yeah.
Okay? All right.
Jesse, you're spoiled.
Dana said the only reason you're doing this is so you can travel across the country and get work done by everybody for free.
Yeah, but I mean, if you're smart, you're smart. What are you going to do? He's pissed that he didn't have the idea first, I think. All right, I'm going to get a little lotion here.
And shirt on, off.
Go ahead and pop it off, thanks. Okay, so I'm going to get in there and palpate and feel this guy, but then feel that guy. Yeah. And just looking for tension in the tissue here. I'm going down to the first layer of resistance. I'm not trying to dig in and see how far into his abdominal cavity I can get. We already know that's going to hurt plenty. So tell me, as far as tenderness goes, is it left or right?
I'd say right more than left.
Okay. Yeah, I'm feeling that too right there. And then I'm going to come into Iliacus. And I'm going to just palpate quads here. Yeah, okay, good. So I think what I'm going to do is kind of show you a little demonstration of how I would go through kind of a normal patient. You're not super restricted in there, which is fantastic for your health. Like to hear that. But we'll use a couple of these cool little tools to help
I hear stories
get into the
guys.
fascia. So this is just a silicone and acrylic tool. This piece is silicone. It's got grooves cut into it that allow me to penetrate through the tissue, and my goal is to get to the third layer of fascia. Once I get there, I'll grip it and then I'll move it. And what that does is just kind of breaks up the disorganized tissues that are in there. But bottom line, what my goal is with fascia is to heat it up. I'm just trying to bring blood into that thing, baby, because I know that there was an argument in physiology: is it a contractile tissue like a muscle, or what the hell is fascia anyways? And as it turns out, it does have some muscle fibers in it in many places. However, not enough to make the whole tissue contract. So we believe it's not a contractile tissue, but it really loves to open up to heat. So that's what we're going to get into right now. Now when I work on a scale of 1 to 10, 10 being pain. I never want to go above a 7.
Okay.
I'm working with the nervous system. I'm not trying to overrule it. If you piss off the nervous system and you create pain, you're going to have problems with your treatment. So the idea here is to communicate with the patient and to work at a 7 so that they breathe normally and the body stays calm.
All right.
Okay, so here we go. Just looking for tension in the tissue as I come through here. And you'll see his body start to imprint a little bit with what I'm doing, and it will imprint or turn red where he's got the most resistance. So I'm going to work a bit through his stomach, little psoas, and remember, am I working on psoas because I'm working right here? Not directly, no. But to work on psoas, remember psoas is under your organs even. So I got to go through muscle and organ to even attempt to get to psoas. So what I'm using is Hilton's law, and Hilton's law states that every structure in the body has nerves, or soft tissue structure has nerves that grow into the skin. So if he had bone in here, those nerves from that bone would grow right into the skin, and I could stimulate that bone through the skin. So that's really what we're doing, is we're stimulating the cutaneous nerve receptors to tell the brain, to tell the muscle to relax. And so why do I use this technique? Because working deep on somebody at an athletic event, and my background is working at events for the last 35 years, and working on them when they compete, you can get a great change if you really go in deep on someone. I mean, you can get profound changes, but they're not going to be able to compete. They're going to want to go to sleep. You've just disconnected that connection between the brain, nervous system, and muscle. I want to reconnect when I do the work, and so the work that I do is always reconnecting. At least that's the goal. Okay, just pull that pant leg way up there. That's right.
Right about there.
Give me some of that G money.
My money makers.
All right. So now I'm going to follow sartorius up and see if there's snags in that muscle. And you'll feel them along the way. And even though these are tools, and I was really kind of anti-tool for so long because I really thought it would mess with my touch, you can feel tissue through these tools very nicely. You're just looking, you're just feeling for resistance. So you see me, I press down, I give it a little twist to grip onto that fascia, and Jesse feels me gripping onto that fascia right now. And then you just pop it like that. And now you'll see a lot of redness starting to come into that muscle because I'm bringing blood flow to it. And like I said, normally I would just do this with my hands, but I'm not affecting the fascia, I believe, in the way that this tool can do it. Going to come all the way up to the ASIS where all these, that upper, where the quad attaches and sartorius attaches. Okay, great. And now we'll get into this old tool here.
Ooh.
And what we're going to do here is, again, we're working on fascia, so I'm going back and forth to create friction on that fascia. When I do my soft tissue work, I only go in one direction because I'm really trying to capture those cutaneous receptors and get them to really tell the muscle what to do, and I can't do it if I go both ways. I can only do it if I go one way with my hands. So different ways to treat fascia versus muscle. So you can see I can cover a nice broad area with this. And how are we on the numbers? Are we cool?
We're chill.
Great. Yeah, normally I'll work on a muscle. If I'm taking it muscle by muscle, maybe I'll work on a muscle for a minute with each of these tools. Okay, so it's not a super long treatment with it. It's really just kind of waking them up. Iliacus is a tough one to get with these tools, so I usually just use my hands there. I can get the bottom of it right down here. And this is right where Jesse's having a problem, right in the crease here. And on most of your patients or clients, if you palpate here, with their permission of course, if you palpate here, you're going to feel like there's somebody dumped a whole bag of sand in here into this tissue. And it's just the body's kind of the texture of the fascia that goes through there, and then the concentration from all the contractions that you've had in there. So this area is really compressed and condensed. And if I could think of one word for these treatments and the training and all that stuff, if I can think of one word that we're looking for, it's space. I'm just trying to give your body space. Great, okay. Well, that's that little tool. Now I'm going to go back to my hands again, and then I'm going to go through all these muscles real quick. And how long do I work on each muscle? 50 to 200 strokes on each muscle. And each one of these strokes is diagnostic for me. So my head has to be in my fingers each stroke. Otherwise, I'm just an automatron. I'm really not learning anything or helping the patient out. So I just felt a very nice change in his tissue. You can never predict when it's going to happen, but in this case, it just completely laid down for me. You feel that, Jess? I mean, there's no fight in that tissue at all, and you're good once you get that. So that was a nice little bonus, Jess. Thank you for throwing that at me. Okay, so now off of Psoas, I'm going to get into Iliacus, and now I'm going to have Jesse fire up his brain and nervous system and take this information below where I'm working. So I'm just going to have him internally rotate his whole leg 20 times. So it's 2, a little quicker, 3, 4, 5, 6, 7, 8, 9, 10. Pressure okay?
Oh yeah.
3, 4, 5, 6, 7, 8, 9, 10. Beautiful. Now go ahead and bend the knee up. Remember, those muscles are 360 degrees around. They got lots of different angles. The more movements you use in there, the more surface area I'm able to get. Usually the better the result.
Yeah.
So I oftentimes change into positions that give me an advantage over that muscle. I really want to take that tension out of there. So again, just kind of feeling what I've got here, and then I'm going to add passive motion because I want to get into some nooks and crannies in there. And then I'm going to go ahead and approach it inferior to superior. And again, just looking for tension with my fingers, just looking for areas that resist me more than others. And then focusing on that area that resists me the most. So I went right down into adductor here, it just drugged me right to it.
Felt it.
And again, if you think back to the tests that we did, there were some issues here, so we're addressing them right now. I think I'll go back to using the disc on this because this is just, it needs it. It's just, I think they call this 10 pounds of poop in a 5-pound bag or something like that.
Yeah.
All right, let me get a towel on that. Hold that foot right there. Thank you. Any questions about this stuff, my man, so far?
No, I'm just.
Does it make sense?
Yeah, no,
Okay.
it feels awesome. Like the transition you mentioned, I felt that, and no, in my mind I start to go with something like the adductors, where I'm always bringing them into the game if I'm doing foundation? Is it something where you'd say almost back off on
You have to create, you have to do, I'd say encourage movement, but only in length.
Okay.
You don't need to contract these things much more right now.
Right.
Okay. Usually this is a program where it's just stretch for most people, or excuse me, it's stretch and tone for most people. In your case, it's just stretch. Usually it's stretch only on the outside and on the anterior portion. It's usually stretch and tone on the medial portion and the posterior portion. And I'm using a towel on the surface because the leg got a little slippery with the lotion I was using. And this allows me to eliminate that problem for the disc, and I can get right into that muscle and work out where it's tightest.
People are going to want to know how they find someone like Tim Brown out there.
You know, find someone that lives what they talk about.
Yeah.
That's really all I can, you know, add to that is, you know, if they're living what they're preaching, they know how much work it takes. And they know that simply coming in and getting adjusted ain't going to do it. There has to be a reason behind why you had to be adjusted. And that reason often takes a lot of time to build up. And it's almost innocuous in that you don't feel it while it's building, other than these, well, maybe I'm a little tighter today. If you're involved in a sport or activity, that's a big advantage than just going to getting in the car, riding to the desk, riding that desk all day, get back in the car and doing it again. Yeah. If you're doing something dynamic so that you can have feedback from your body all the time, you're going to know before an injury happens. Oftentimes people desensitize so slowly over time, they reach behind their seat to pick up their briefcase and blew out their rotator cuff. I can't tell you how common that happens. Whereas if they were in touch with their body, they felt the chest tightening up, they probably had tension in the neck, all this stuff was pulling forward, and they didn't correct that. So the body said, you're not hearing me, I'm going to make you hear me now.
Yeah.
And that's really what happens. The body's always talking. When I first had my back problem playing football in college, I couldn't read my body. It took me years to really understand there's a sequela that happens before I go down for 2 weeks. And once I started to recognize that and hear that and operate based upon those symptoms, not wait till I had symptoms or bad symptoms, now I could start to defeat this thing. But until you really face the bull and grab it by the horns, it'll keep beating you down. In fact, 3 things: frequency, intensity, and duration will all increase when you're getting worse. All those things decrease when you're getting better, and your area of pain, if it was this big initially, will become this big. You're healing when that's happening. So fortify the things that feed that shrinking of the symptoms, and then eliminate the things that add fire to it.
Wow.
Yeah. Okay. Oh yeah, that baby's feeling good now. Let's see here. Oops.
Now, I don't want you to do what happened to Lorena yesterday, where you get caught in this thing and we run out of time, because she was actually, you know, we were.
Oh yeah, I don't know what time it is.
It's just 1.
Okay.
It's
Wait.
1?
Yeah.
Okay.
Oh crap. See?
All right, well, we'll get in as much as we can, right?
Yeah.
So what I'm going to do now is use this little tool on you. So we call this positive pressure.
Okay.
All the muscle work, all the machines you use, all that stuff is positive pressure. Now we're going to use something called negative pressure. And of course, you've heard a lot about that through cupping.
Yep.
Cupping is negative pressure, so it's pulling up on the tissue to allow circulation to happen. Now we've got this killer machine from Finland. I'm going to break it out for you. And it's really awesome at adding this negative pressure, and in a way that's very unique
Oh wow.
to my experience. In fact, there.
Right on time.
Okay. Plug her in.
All the way from
Finland.
All the way from Finland. Yeah, they created another thing called 6D tape as well. I will show you that. So 6D is a company that's really about improving health through improving lymphatic health. So I met them through somebody who gave me a phone call and said, hey, you came out with this great tape that's a tab taping and you're using it for lymph stuff. And I said, no, I'm not. And so I got a call later on from a company that was representing 6D and said, we took your technology, we're using it for something different. But for the first time in my career, Jesse, they cut me in on the deal. So I created this tab taping probably 1987 or so. And it's really great for what we use for taping. These little tabs become levers that I can put tape over the top of, and then that lever becomes the new ligament or the new muscle. What they're using this for is to help the lymph system. So I'm going to apply it to you and see what your body thinks about that. Let me see if I can.
For the road here. Poor GC's going to fall apart on the road, but I'll be good.
I need to grab some scissors real quick, brother. There we go.
Yeah, Tim.
Uh-huh.
So you're going to make sure you get time to interview for a moment.
Sure. Yeah, it's Troll's coming, so
Yeah.
he's cool. So I'm going to utilize the 6D machine on you first, and then we're going to use this as a supplement. And we're going to supplement the master lymph node, which is a left subclavian lymph node. Lymph system is a passive system. You need to move or have it moved. It doesn't move on its own. So, you know, when we're hurt, obviously lymph system slows down and so forth. So this is a way to stimulate the whole lymph system. It's pretty cool. And you can put these, like, for instance, in areas where you've got lack of circulation or overused muscle, an area that's super tight, you can put this on the skin, and I'll put it on your forearm for a demonstration here. But what this will do is you can allow the patient to work on their issue when they're outside the clinical setting. Now, it normally takes 5 to 15 minutes for this stuff to adhere, but what I want to show you is how the patient can now do some myofascial work, lifting that skin and turning it and bringing circulation to the area, you know, while they're passively doing their day.
Yeah.
So it's another great way. You can put this on lower body, upper body, anywhere you need to move blood flow and tissue, and anywhere you want to add to the lymph system, you can put this tape on and it'll help stimulate that throughout the day.
Sweet.
Yeah. So what we'll do here is start with that guy. So what this is it's got the cup on it, but it's also got rollers. And that's why I like it. You can put a little lotion on the skin. That helps the rollers glide a little bit easier. And now I'm applying pretty strong negative pressure here and lifting up the skin and stimulating lymph, stimulating circulation, and actually really does a good job working on muscles as well. We utilized this at Pipeline last year for the Pipeline Championships, and again, I really look at these things like how big is the line for that particular tool, and yeah, so this machine got a lot of usage over there and releasing a lot of tight muscles from paddling, etc. So it's great to flush the body as well as great to help us work on injuries. So you can kind of feel that moving through there.
Yeah.
And I can go through quads, so it's again a great adjunct to all the soft tissue stuff I already showed you. That's positive pressure. Now we've got this nice negative pressure lifting all that tissue up there and helping to stimulate circulation. Out with the old, in with the new. So, you know, I'm not looking for perfection today, but I'm looking for progress, okay?
Yeah.
So, and that's kind of the mentality I want you to have too. It took a long time for you to set the muscles up like this and to have the imbalances that you have. It's going to take some time to get rid of them. What I've learned in my experience is if you've had something for 12 years, probably going to take you a year. It's about a 12 to 1 factor, and that's a pretty good deal. At least it's not the other way, you know. We don't have that many years to live in life. So your body really wants to heal. It really wants to do the right thing if you provide the right environment.
Right.
So that's why all these tools, you know, from breath to mobility to alignment, etc., are very, very important for us all to have in our kits. So just a little demo, right? It's kind of nice.
Wow.
And you can do it on your own body. Feels great.
I want one of
He
those
wants more, right? Cool. All right. Now I want to get just into this groin a little bit on this side, and then we'll get you up and test you.
Awesome.
Okay, so let's go ahead and pull that pant leg up. Okay, so through our testing, we already know that he's a little tight in the adductor area here.
Yeah.
So we'll just go through and bust up some of that fascia, bring some blood to it.
Yeah, I got thrown on this crazy power plate the other day with bands and a bar.
Oh,
And
really?
I haven't done, it was front squat, it's these front squat thrusters. Really neat system.
Huh.
But, you know, I felt great, it feel great, but I was like, I'm awfully tight after that. And I was like, you didn't do
Yeah, they got to have,
it was over.
yeah, those kits should really come with instructions to lengthen after you strengthen.
Yeah. Yeah.
And that's a really big component too. Anybody that goes into strength training, they got to finish by lengthening. Anybody that goes into strength training, also, I never want them to finish out of alignment. I always want the exercise to finish in alignment. So if you're doing exercises that end here, right, or that end here, you're going to look like that. That's just the way it is. Most of those muscles get plenty of work during your activities of daily living.
Yeah.
I'm all about, let's just open this thing up and let's work towards posture. So if an exercise doesn't move me towards alignment, I'm really questioning the efficacy of it.
Yeah.
Okay.
I have so many takeaways to chop out of here, Tim.
Oh, great.
Like,
Great.
oh man.
What's the number on that one there?
Oh, I'd say 5, 6.
Okay.
Not even. Tim, while you're working on that, can I ask you what
Please.
advice do you give people when it comes to things like nutrition?
Well, I mean, it just depends on how deep down the hole you want to go.
Yeah.
So, you know, it's basically, you know, what is your hydration? And then also, what's your food look like? Give me 5 days of breakfast, lunch, and dinner. What does that go through? What do your snacks look like? Yeah. And if someone gives me 5 days of what they're eating and drinking, I'm going to have a pretty good idea if they're deficient in certain things. And then if they've got a pathology or something going on, certainly I work with you know, medical doctors and others, naturopaths, that can help me to understand better these other systems that I'm not an expert in. But I think eating live food is a very good way to say it. Eating foods that were, or only eating foods that were foods 150 years ago is a real good way to go too.
I haven't heard that one yet.
Eating foods that have very few ingredients.
Yeah.
Like you know, the old Italian mamas, you know, when they make bread, it's got like 4 or 5 ingredients in it. Now you look at the breads that we have, it's got 25 things, and 20 of those things you can't even pronounce.
Yeah.
So the fewer the ingredients, usually the better it is. They're not trying to hide stuff in there. But fluid-filled foods are the essence, you know, from fruits and vegetables to everything else you can eat. I'd say, you know, I'm more not eating meat than eating meat.
Yeah.
You know, do I eat meat? Yes. Do I crave it? Not like I used to as a football player, that's for sure. Just eat a lot of tofu, mix it with vegetables, and that, you can flavor that stuff up to taste just beautiful.
Yeah.
So, I'm an advocate of eating anything I can that's organic. That's really important. We eat a ton of avocados around here.
Yeah.
We like that oil. We eat a lot of extra virgin olive oil as well. So yeah, we try and eat the whole foods that people take supplements for.
Right.
And the stuff we put on our skin, we usually don't put on our skin unless we can eat it.
Mm-hmm.
So those are kind of some components for sure.
Yeah.
There's a company in Australia that can do tests for you that test your urine and your saliva to tell you how hydrated you are, what kind of nutrients that you're missing. So that's kind of cool. Yeah, it's Be Alive. So I can send you information on that too. It's really interesting stuff.
Awesome.
Many of the scientists that I work with aren't so sure on that, whether you can read this stuff outside the body or not and be as accurate as you need to be. But my trials with it were very, very successful.
Very cool.
Yeah. It was the first time that I had in my life that I can remember more energy than I had fitness to match. And this was at Tavarua, where you try and get in the blue zone on this thing. And I got in the blue zone there and I had plenty of energy. I just couldn't lift my arms anymore. You know?
Too many ways.
Yeah, so so for me, that was a really good positive test that there's some knowledge to be gained from that.
Cool.
Great, okay. Okay, just a few more strokes in there.
Maybe what I'll do is I'll hit you with the couple questions I have in front of your charger.
Oh yeah, good.
Big guy.
Okay, cool.
Get a blast for the road.
Is Troll here? Do you see him? Oh yeah, he is. I got him, then I got another person coming.
Busy man of demand.
Shit. Maybe we'll have Troll sit in with us on the machine or something.
That'd be awesome.
Yeah.
Love to hear.
And he can.
Yeah.
He's a great orator, so you should ask him some questions about his experience here.
Yeah, for sure. I'd love to. We play a little too long in the ocean. Every time.
Yeah.
Every time.
That's why we've got to usually have a producer here.
Yep.
To wrangle us.
Yeah.
Okay. Let me go ahead and take this out from under you. Great. I'm going to pull you towards me. Great. Look at the feet a little bit for a second here. Bend that knee up just like that. "26 bones in a little box here of we call the foot. So it's nice to give them a little love and some separation between church and state.
Yeah.
Great. Plenty of movement there. Good. All right. Slide that up there. This should feel all good?
Oh, yeah.
Good.
I'd say it almost feels overdue.
Yeah, right? Those dogs never get enough love.
Oh.
Beautiful, good. Okay. I'm going to work that TH spine just a little bit. I'm going to roll you like that. Great. Okay, big breath in, tuck the chin, sit on up, air goes out. Great. Great. Nice. Nice. Oh, it feels good. Come on up. Okay. lock the fingers behind your head. Elbows in, roll back. Beautiful. Elbows out. Big breath in, all the way out. Good. Great. Okay. Okay, go ahead and stand up.
All right.
Just moving around a little bit. So, there wasn't a ton of compression back there, but this should feel like you can go even further.
Oh yeah, I'm ready to go for a ride. I feel like I'm flowing.
Oh yeah, okay, that's great.
Yeah.
And then go ahead and just squat and just see how that pattern feels now. It should feel like there's more space in there too.
Big time. Yeah. I feel like I don't want to sit in the car for a long period of time.
right, for sure.
No, man, it's awesome. Dude.
Cool.
So, what I want to ask you while I got you mic'd up and while we're here, any advice for people out there that are watching all this and going, okay, there's so many things that resonate. What advice do you have for them?
Yeah, again, you want to look for somebody that kind of has similar philosophies of, you know, we're not trying to get you into the gym just to make you stronger. We're not trying to get you into the clinic just to adjust your spine. We're really looking at you as a whole person. You are what you eat, think, and do. And each one of those things has to be concerned. How do you sleep? How much water do you drink? You know, what are your relationships like? All those things are critical components to your ability to heal, because those things set up your mind and your attitude as to how you're going to move forward. So if you've got all these anchors pulling you down, we need to know about that so that we can help to understand that and provide a plan that's maybe more adaptable for you.
Yeah.
As opposed to the guy that's got, you know, professional athlete that's got all the time in the world to spend their time on these things. We need to really find out what is your number one objective. Find someone who understands that where you move the least and where you move with the most difficulty is an area that you really need to focus on fixing first and foremost. And then you move progressively through those areas. You know, once you clean that area up, I guarantee when you're halfway through, there's another area that's going to sound off. And it wasn't because that area wasn't already there, but your body has a really unique way of prioritizing its areas.
Right.
And it just so happens that we can correlate a lot of the tension into a lot of the injuries that we see.
Yeah.
You know, I say correlate, not causative, because nothing is perfect. And like I said, there's too many systems to say this is exactly what it is.
Right.
I can't always speak with that much straightforwardness as I'd like to, because it's just not the truth.
Yeah.
You know, there are too many other factors, too many variables that must be considered. And if you're truly treating someone holistically, you're treating the whole person, as opposed to the reductionist model that treats you as a low back.
Right.
I don't even know Jesse, I just know that's his back. And that's all I'm going to work on, because that's in the history, he has low back problems. If they're focused on your pain, they're not focused on you, that's a big problem.
Okay. Awesome. And our last one, because I know you got people
No
piling
worries.
up waiting for you.
No worries.
How do you define wellness? And you've said it. I've heard so many different
Yeah.
But there's so many great things right now. But how would you define it if I gave you that specific?
First of all, there is no real wellness. You never really reach balance. That nirvana thing that you're shooting for, all the chakras firing and everything. You know, first of all, we're right-handed or left-handed, right? So that obviously puts us in an imbalance. There have been anthropological studies that show anything that moves that's organic, like a virus or a bacteria or an insect or an animal, moves with asymmetry. If you look at the way our rib cages are set up, if you look at the shape of our heart, bigger on the left side. What's up with that, right? And how are we supposed to balance all that stuff? I don't think that it's a destination as much as it's a journey.
Yeah.
So balance, I think we should look at as a journey, and we should all be on that journey, by the way.
Yeah.
It's just, don't be too upset for not reaching it.
I love it. Now, there was a quote that Dr. Lorena Lee wanted me to pull out of you. Do you recall it? Otherwise, I'm going to pull from GC. You said it at the start today.
Yeah. I think it's something that's just really important, and we don't hear it enough because of the way our society is shaped and our social mores. And it's simple. It's look for progress. Don't look for perfection.
Love it.
You know, if perfection is going to happen, it's going to happen along the way, and it might happen while you're asleep, and then by the time you wake up, perfection is gone again. So I think it's just, again, it's that progress. It's that being able to stumble, trip, fall in the direction of balance, you know? But don't look for this perfect route. Don't look for the perfect mentor. You are your perfect mentor. There are people that will come into your lives that will make tremendous differences. But as in everything, you'll ride that out. And then it's time to move on to the next one. And I say that to all my patients. I think it's really critical that you see other people, that you get other opinions. I know everything I know based on my experience and my education. But it's this much in a sea of knowledge. But I think it's like I say sometimes, alone we're but a drop in the sea, but together we are the sea. And I think that's kind of the attitude we have to have. No one should be afraid of another profession if we're really truly here for the right purpose, which I think is to help humanity and help other people live life at a higher level of quality.
Love it. So last but not least, what are you working on? What are your current projects? What do you have for us out there? Because I know there's a lot of people that are like, I want to learn from this guy.
Oh, thanks a lot. Well, I'm always open, you know, in this strange COVID time to people just, if they can find me, I'm there to answer questions. You know.
How do they do that?
I'll
include what I'm allowed to include at the end.
Dr. TB22 at Gmail. So drtb22 at gmail.com if they want to contact me directly. I do speak at, right now I'm doing some work with Kevin Wilk, DPT, preeminent physical therapist, you know, in the United States, just a guy that's a clinician, a researcher, a great speaker, etc. So I'm honored to work with him. I'm working with Rip Curl and Mick Fanning on a new pair of board shorts. Not the same technology that I used in IntelliSkin, actually some new technology that utilizes a lot of the philosophy of foundation training. Yeah, so a lot of posterior chain stuff that we're going to try and activate with garments.
Awesome.
So super stoked on that.
I'll look for a Goodman signature model.
And outside of that, just trying to keep myself and my family happy and healthy, and you know, keeping moving along with a good attitude. So.
Awesome, bro. Thank you so much for your time, man. I appreciate all of this.
My pleasure, brother.
Yeah.
I got one more thing to show you if you're up for it.
We're in.
All right, let's do it. Okay.
We're going to ride this train as long as we're allowed.
Did you want to ask about incorporating XP into his practice or no?
He said so much about how it is. I won't even worry.
Then let's see the seat.
Oh, damn.
Hey, T-Boy. Okay, so it starts off with just 2 warm-ups.
Okay.
And I like that little modified child's pose.
Yeah.
And this is a great stretch to do on the couch or on a table. Everybody, you can't get enough of this stretch right here. Thumbs up, really important. Try and sink your head between your shoulders. And you really open up the arms, open up the area underneath the armpits, an unheralded area.
Okay.
The subscapularis, upper lat, serratus anterior, posterior are very important muscles to get for posture and for movement. So that's position 1. Position 2 is just basically a downward dog. Try and straighten those legs out and push back. Again, same idea as foundation and the founder. We're trying to push those hips back as far away from the fingers as possible. And then you step into the, we call it the toilet bowl. Stick your head in there. And then the trick is, Jesse, pulling the knees into the chest.
Okay.
And once the knees are into the chest, you're in.
Knees to chest.
And so you can get right up into vertical. And once you get tired of that, you can start to oscillate a little bit. And this is really nice for the core.
Yeah, heck yeah.
Go back the other way. Come into some striders. And this whole thing happens in a minute.
Yeah.
So it really doesn't require much more than a minute a day on this thing. And it's a total reset.
Wow.
So when I get off of this thing,
Daily play.
when I get off of that thing, I mean, it's a different day.
Yeah.
Feels great. You're up, Daddy. It's called Feet Up.
Feet up. So
Start with a couple stretches, thumbs up. Great, and then come into downward dog. Beautiful. And when you're ready, step forward, head in the toilet. Legs up. Nice. Now, I'm going to put you vertical because you've never been here before.
Ah.
And so now, proprioceptively, you kind of have an idea. I'm back here in vertical.
Okay.
You're in great position. And you feel a little work going on there, huh?
Oh, yeah.
Good. And go ahead and bring one leg forward, one leg back. You can keep them straight or you can bend them. Each has different quality to it. Great. Switch them back. Nice. Those little perturbations, right, really make you lock in your center.
When I thought it was straight up, I was far from
Isn't that wild? Yeah.
Wow, this almost feels like a great, that upper quad flexor.
Right?
Should be in there.
Okay, go ahead and bring them up straight again. Excellent. You could try an L lever if you want to show off for the crowd.
Which was the L lever?
Touching your toes to the ground.
Wow. Yeah. That is just awesome for I'm just thinking of one more great thing for the morning routines.
Yeah, there you go. I mean, right? And like I said, when you only have a minute, it's literally only takes a minute.
Yeah, being able to start the day, do all my normal stuff, and one more toy to
Right.
add to the
I know,
routine.
right?
It's a little bit longer every time.
It takes a while to get a toy in my bag, but if it stays in my bag longer than 90 days, it's a beaut. I'll show you one more real quick one while we're here, and then we'll go do a biocharger, actually two. If you haven't seen this before, it's an Aqua Jogger. It's simply a belt that I put on my athletes that have just had surgery, and they got to move, right? They got to move. Everybody needs to move. So you just adjust this belt on and click it on. And you go in the deep end of the pool. And if I was just to drop off the edge of the pool and get in the deep end, it would float me up to here, just standing in the deep end, not even touching the bottom. So now I can walk, not touching the bottom. And then when I feel like it, I can start to run. I can get long, slow distance in. I can get sprint intervals in. When I discovered this thing, it was when I blew my back out, my discs out, and was out of the water for like 6 months. And I started off, I could do 5 minutes in the water with this thing and I'd be just smoked cardiovascularly. And then I ended up running 10 Ks in the pool 3 times a week. And by the time I was fixed, I was in way better shape than before I injured myself. So that's the thing about injuries, is we can find out stuff when we get injured that'll actually help us in the long run by adding more tools to the kit that are meaningful.
Yeah, that was something when my back a year ago had me laid up for 3 months. It was this thing of suddenly one day it was like you have one injury. You're not broken. You can do other shit.
Yeah,
and
right.
And then
exactly.
healing. It was amazing how fast my body really started healing once I quit trying to attack the pain and just work on the system.
Yeah, if you're on the pain, you're on the wrong boat, you know. And even like working with quarterbacks or pitchers, right arms dusted, man, as soon as they can, we're throwing left-handed. It stimulates the brain in a really, really positive way, and it seems to make them come back quicker. It wakes up the other side, because one of the things we didn't talk about is when you have an injury, you have a stroke. It's basically like a stroke. So if you blew out your shoulder, this whole area, well, let's use the knee for example. If you blew out your knee, everything below that knee has no communication with your brain anymore. So, and then add into every 24 hours you atrophy 1%. So add that to it, and now you've got a big problem going here. So what we recognize is that, and why I did the motion with you when I did tissue work, is I need to stimulate down here to help here.
Yeah.
And if I can stimulate above and below the injury with what we're doing with, whether it's exercise or tissue work or modalities, then I'm going to help that injury heal much, much faster, because we need to reconnect, remember, brain to nervous system to muscle. And that's exactly what you lose when you injure.
Wow.
It's complete disconnection.
Awesome.
Yeah, cool.
Yeah,
and then this, one more little tool.
I literally blew my shoulder out, severed the nerve, and had the whole...
Oh, no kidding.
Wow,
Shit. So this is you know, obviously a very tall roller, so you want to be careful doing it because if it slams, you go down pretty hard. But I really like this just because of the physics of it, right? It allows more space between the ground. It gives the gravity more forces. It's able to pull down on me at a little different angle than regular rollers. So the way that you mount this guy is that you get on it just like this, roll yourself back into that kind of tabletop position, and then remember, you're not going to put pressure in your low back ever with a roller. Your low back already has a curve that goes forward. You don't want to accentuate that. But right above that into the thoracolumbar area, and then moving into the thoracic spine, it's just beautiful the kind of pressure that you can put on this. And you can come under or you can come over to help accentuate that grip. Sometimes I'll have a 35-pound medicine ball right here to kind of roll with me to add even more pressure on that. Okay, so it's a really nice way to go.
Yeah.
Here's a great one. The Axeman is a great one. Swimming to the, whoops, there I said.
You set yourself up.
I did, didn't I? We should probably stick those. If you do the swimming moves to the side, I recommend that you do it on a low profile roller to eliminate crashing.
Going down. Awesome,
Try.
bro.
Not unreal?
Yeah.
Just got to watch the rib flare. There you go. Check out the stretch when you take out the rib flare. It just intensifies it. Right?
Yeah.
Now you're pulling from a completely different area.
Oh, I just feel.
Yes. So I tend to be on this roller longer than I do on the lower profile roller.
Yeah.
I seem to get more out of it.
Oof. Right up in the trap.
Yeah, yeah. You can grab behind your head. Grab the, the barrel, yeah. So another great tool.
Yeah, wow.
And then I'll do one like 30-second routine on the JN real quick.
Okay.
You can have it for B-roll or whatever.
Okay. 30 seconds because the battery's about to die.
Okay, perfect. Let's do it. All right, so I'll just roll around on this mat here. So. Let's see here. Yeah, come here.
Give us the rundown, real fast.
So Gymnastica Natural, just those moves got me pretty good.
Yeah.
It's a combination of using your breath work with jiu-jitsu, hatha yoga, gymnastics, and animal movement. So I got to study with Alvaro Romano, who created this technique, taught me about 300 moves that I actually utilize now in my care for athletes. I give them small 4 or 5 move routines that they can focus on to help them stay away from guys like me.
Sick.